Welcome, everyone. We'll just wait for a few minutes while everyone is logging in right now. Thank you. Okay, let's begin now. So a very warm welcome to all of you. Good morning, good evening, good afternoon. Welcome from wherever you are joining, especially to those of you who are from far away where it's early in the morning or middle of the night. Thank you very much for your interest in EPI-WIN. I'm Supriya Bezbarwa, and I'm the lead for EPI-WIN. For those of you who are part of the EPI-WIN family for some time, you'll already know what I'm going to be saying. But for those of you who are new, EPI-WIN stands for the WHO Information Network for Epidemics. And our goal is to make science and knowledge accessible, understandable, and relevant so that you can take it forward and act on it with evidence-informed actions. Today, we have a very exciting topic. It's part of the series in collaboration with the WHO Hub for Pandemic and Epidemic Intelligence and the International IPSN. It's on the utility of pathogen genomics, metagenomics surveillance for emerging threats. And I would like to thank Tim Dahlman for organizing this. And I would like to also welcome Josefina Campos, who's the unit head for this area. We also have three very exciting speakers, experts, Dr. Anna Anyu, I hope I've pronounced it right. She'll be talking about metagenomics for public health surveillance and biosecurity. She's a consultant in infectious diseases and microbiology who splits her work between a public health role in UK HSA, where she works in the acute respiratory infections unit, and a clinical role in the NHS, where she works at the Barts Health NHS Trust. Then from the UK, we go to Brazil. So Ricardo Cury is a full researcher at the Oswaldo Cruz Foundation in the Brazilian Ministry of Health, as well as adjunct professor at the Federal University of Bahia. His expertise is in immunopathogenesis and molecular surveillance of infectious diseases. Finally, from Brazil, we will go to Cambodia, and I'd like to welcome Dr. Eric Carlson, who's from Institute Pasteur du Cambodge in Phnom Penh, Cambodia, serving as head of the virology unit and director of the National Influenza Center, which is also a WHO H5 reference lab. He's an internationally recognized expert in influenza, both human seasonal and avian, and other respiratory diseases, particularly with those with zoonotic and pandemic potential. So Ricardo will speak on metagenomic surveillance in Brazil, whereas Eric will talk about metagenomics at the One Health interface. Then, of course, it's your turn. For all the audience, there's Q&A session. And for that, we have two great moderators, Greg Armstrong of the Task Force for Global Health and Caxton Murira, Science for Africa Foundation. So to all our attendees, Please put your questions. We'd love to hear from you. Please introduce yourself in the chat. But when you have questions, please put it in the Q&A so that we can keep track of your questions. The general housekeeping, this is being recorded and the recording will be shared on our website. And also, please keep all your comments. We'd love to hear your insights. Please keep it respectful and to the topic. This is for sharing, learning, understanding what we all do. Let's keep it that way. Let's keep it positive. Anyone who is disrespectful or moving into irrelevant topics will be removed. But I hope we don't have to get to that. Once again, welcome. And with that, I'd like to hand the floor to Dr. Josefina Campos. Over to you, Josefina.
Thanks, Supriya, and thank you everyone for joining this edition of the IPSM Pathogen Genomic webinar series co-hosted by EPI-WIN, the Science for Africa Foundation and the Task Force for Global Health. Just an introduction of the International Pathogen Surveillance Network. So it's a global network of pathogen genomic actors that brought together by the WHO Hub for Pandemic and Epidemic Intelligence in Berlin as part of the WHO Health Emergency Program. The vision of IPSN is a world where every country has equitably access to sustained capacity for genomic sequencing and analytics as part of their public health surveillance system, and the function to create a mutually supported network that can amplify the work of its members and accelerate the progress in pathogen genomics, improve access and equity, and ultimately contribute to improved public health decision-making. To support country capacity building activities, in this webinar series, we aim to provide a forum for expert discussions on how pathogen genomics is being used in public health and in clinical healthcare settings, and to review the evidence base for its utility supporting decision-making and informing policy. For previous webinars, we had spotlighted the utility of pathogen genomics for specific pathogen use cases, while in this webinar series, we would like to consider an emergency technology, metagenomics. Metagenomics represents sequencing directly from biological material, be that at a clinical or environmental sample, and usually without any amplification, enrichment, or culture of a specific target organisms. Such approach provides an opportunity to survey complete microbial communities and provide the potential to detect the presence of multiple pathogens, including those that may be novel, emerging, or re-emerging. In today's webinar, we will hear about multiple use cases of deploying metagenomics in different surveillance settings and to answer different public health questions. We hope this webinar outlines some of the practical considerations in using these tools to support public health surveillance and decision-making.
Thank you so much, Josefina, for those remarks. Now, before we go to the technical session, I would like to invite all our participants to tell us what they think about metagenomics. So please join us at slido.com, hashtag 6510944. That's slido.com, hashtag 6510944. How is metagenomics useful in your view? We're not getting any responses. Can you access it? Is there a problem? Unbiased, yeah. Now then. Random. Fast diagnostics. Adds value in decision making. Comprehensive. So fast diagnostics, agnostic diagnostics, pathogen discovery, yeah, the pathogen discovery, pathogen detection. So it's great. There's one that says adds value to decision making. Unbiased, I think, comes out the strongest. That's the advantage, according to the audience. ideas about emerging pathogens, strategic use. Great. So in the interest of time, thank you so much for your responses. Please continue to respond to this. I will leave the Slido open, slido.com, hashtag 6510944, but I will not share it on the screen anymore because we will move on to our technical session. I now invite Dr. Anna Aryi to give her presentation. Over to you. The floor is yours, Anna.
Thank you so much, and thanks for inviting me to speak. Can I just check that you can see my slides and that they're moving? I know
Yes,
we
we
checked
can.
earlier. Okay, that's great. So my name is Anna Ayi. I'm a consultant in infectious diseases and microbiology, and as mentioned, I work in the acute respiratory infections unit at UKHSA, and I also spend 50% of my time in a clinical role at Barts Health NHS Trust in London. So I'm going to speak today about the use of metagenomics for public health surveillance. I'm going to be giving just a very brief overview of metagenomics as compared to previous diagnostic techniques that have been used. I think other speakers are going to go into sort of more specific use cases. I'll then talk about what the public health applications of metagenomics are. I'll discuss some of the challenges to that implementation, and then finally I'll just say a few words about how the UK aims to use metagenomics for public health surveillance and a project called EMScape, which we have started. So over the years, we've seen huge developments in diagnostic capabilities, in particular molecular techniques and sequencing. So we started with culturing organisms in the lab on a plate, which for many years was the only method of bacterial diagnostics. But as many of you know, that takes time. We then have polymerase chain reaction, or PCR. So that's a molecular technique which can detect organisms rapidly, direct from clinical samples, and that's been in use in virology for much longer than it has in microbiology. And this identifies the organism by identifying particular targets in the genome. But importantly, you need to know what you are looking for to use this. We then have whole genome sequencing, which sequences the entire genome of a particular pathogen. But again, you have to have identified the particular pathogen in order to do that. We now have metagenomics, which can be described as essentially whole genome sequencing of everything that exists in a particular sample. So all the bacterial DNA, all the viral DNA, all the human DNA. And as many of you commented earlier on, it's unbiased. So that means that it's pathogen agnostic. You don't need to know what you're looking for in order to find it. And importantly, it can also be done directly from clinical samples. So these two properties gives it enormous potential for public health surveillance, which I shall come on to shortly. And because it sequences everything in a sample, it has the potential to detect novel pathogens that we wouldn't know to look for example, with PCR. And it's also much quicker than culture, which can require days in the laboratory. And as we know, culture is also flawed in that certain organisms are very difficult to grow. So our view of pathogens causing human disease is very much biased towards the pathogens we can grow and detect in a lab. So the pathogen agnostic nature of metagenomics and the fact that it can be done on primary samples is what gives it such potential for public health surveillance and biosecurity. So what are the public health applications? Well, I don't need to tell this audience that global health threats are increasing. Examples such as Ebola and COVID-19, we've seen how quickly outbreaks can spread. And traditional diagnostics often target one pathogen at a time, which can delay recognition. Metagenomics offers us a broader and faster approach. And crucially, it gives us a system-wide view of pathogens across humans, animals, and environments, giving us that one health approach that we all aim to achieve. In the field of outbreak detection and response, it can be used. I mean, one of the key things here is the speed with which things can be detected and the fact that you can detect novel pathogens. And obviously, early identification of novel or unexpected pathogens is obviously crucial in mobilizing a public health response. In the field of biothreat detection, engineered or unusual organisms can be found in environmental or clinical samples. Air, water, and soil can all be sampled for biothreats or emerging risks. And examples of environmental sampling to date include wastewater surveillance for SARS-CoV-2 to detect new variants, and also for influenza A H5N1 in the recent outbreak in dairy cattle in the US. In the field of antimicrobial resistance monitoring, we can track resistance genes again across that human, animal, and environmental reservoirs. And importantly, we know that AMR genes can often be transferred across pathogens, and metagenomics, in a sense, allows us to follow the resistance rather than just the pathogens. In the field of surveillance of endemic and neglected pathogens, particularly for neglected pathogens, it could allow continuous monitoring for diseases with low reporting levels. And finally, which I know we're going to be coming on to later, monitoring of zoonotic pathogens at the human-animal environment interface, again, giving that One Health perspective, linking those three sets of data for comprehensive biosurveillance. So what are the challenges? Of course, anything that has such huge potential will also come with some challenges. There are significant technical considerations, for example, with contamination of samples or low abundance detection. So detecting a pathogen in an amount or an abundance that makes it difficult to be sure of its significance. It's also technically complicated to interpret unknown sequences. So the identification of novel pathogens is not necessarily straightforward. Metagenomics creates a huge amount of data, and that brings significant computational demands. And there is also a lack of standardization and data interpretation that we need to work on, really. A large area which we're focusing on at the moment in UKHSA are the sort of ethical and legal considerations. So at present, we share pathogen data across different agencies and even internationally to maintain public health. The complication with metagenomic data is that it contains also human genomic data. And this data is removed as far as possible, but there is obviously the concern that any residual human genomic data could inadvertently be shared, which obviously raises ethical risks. So there's a real need for an ethical framework and indeed standards and guidelines that help us to maintain sequencing quality and also strengthen our confidence in the removal of human genomic data so that such data can be shared safely and responsibly. And then finally, there are operational considerations. So there is an upfront cost in setting up metagenomics platforms, and then additional costs in maintaining that infrastructure. And there's obviously also a cost associated with upskilling the workforce. I certainly didn't get any training in metagenomics in my microbiology training, and I suspect many others didn't either. And these considerations are obviously even greater in lower resource settings. So how do we hope to use metagenomics in the UK to strengthen our health security? Well, we hope that it'll give us a broader biosecurity net, helping us to keep pace with the evolving threat landscape. We hope that it'll allow us to detect threats and pathogens earlier, meaning that we can also institute public health measures earlier to reduce their impact. We hope to gain richer insights into particular pathogens, and that characterization of, for example, virulence factors or AMR will allow us to make better informed decisions around countermeasures. And finally, we hope that all of this will provide value for money overall, providing a more efficient surveillance system. So as part of this, we have implemented a pilot study called MSCAPE. This stands for Metagenomics Surveillance Collaboration and Analysis Program. And this is a pilot study which will ingest metagenomic data from a number of different sources. That includes public domain data sets, a few research cohorts, for example, the SIREN study, which is a study of healthcare workers, which was set up during the COVID pandemic, and also data from NHS clinical services, including patients with severe respiratory illness, which is headed up by our colleagues at Guy's and St Thomas's NHS Trust, and also samples from returning travellers, which is headed by our colleagues at the Rare and Imported Pathogens Laboratory at UKHSA. There will also be newer data sources coming online at a later date, including environmental pilots using aircraft wastewater, and also samples from patients with neurological disease. And as part of this study, the core analysis functions we are testing are the large-scale processing of metagenomic data, so to allow surveillance of all our seasonal and endemic pathogens. We're looking at detection and confirmation of high consequence and high threat pathogens, should they be present. We will be looking at approaches to identify signals of novel, unusual, or evolving pathogens, and whether that be detection of the pathogen itself or looking at patterns of other organisms that might be present in the sample. And then finally, we'll also be doing some further characterization of a smaller panel of organisms, such as Streptococcus pneumoniae and influenza A, to see if we can confidently identify things like virulence factors and AMR markers in order to better inform our countermeasures. So looking forwards, this is what we're hoping to achieve on our pathway to national surveillance using metagenomics. So we hope to have an integrated surveillance system which uses clinical and environmental samples and gives us the potential for a One Health sampling framework or several frameworks. A large part of this is a health economic assessment, which will evaluate the utility of metagenomic approaches as compared to our existing surveillance approaches to see if and how metagenomics can add value to our existing surveillance. We're also working on developing an ethical framework together with academic partners and others, which will help us to share data safely and legally. And finally, we are looking to leverage our existing partnerships that we have with various clinical and academic partners, as well as other government departments, in order to accelerate the widespread implementation of metagenomics. And that is my last slide. Thank you very much.
Thank you very much, Anna, for those insights. You can see from the number of emojis that it's been really well received. It's great. We have a diverse audience, so thank you for addressing it to different levels of the audience as well. I'd now like to invite Ricardo to please talk about the experiences from Brazil. Over to you, Ricardo. Oh, before I hand the floor to you, Ricardo, I'd also like to tell the audience that we do have interpretation in French and Spanish. Thank you.
Hi, everybody. Thank you very much for the invitation and for the chance to present our action in metagenomic surveillance in Brazil. So my name is Ricardo Cury. I'm from the Oswaldo Cruz Foundation, and I'm also a co-PI of the genomic network of Fiocruz and the ESOP consortium. And then we are working together with the IPSN and the World Health Organization, the Berlin Hub, for the results of those projects. So as introduction, the global need for sustainable early detection surveillance system, as underscored by the COVID-19 pandemic and other pandemics that we had along the years. And metagenomics has emerged as a powerful pathogen agnostic diagnostic tool limited to academic context and disconnected from formal surveillance system. So basically, as Anne said, we lay, sorry, is it okay? We lay in different techniques. We have the first one, detailing amplicon sequences, and those depends on know beforehand the pathogens in the sample. And then I frame it together, despite there are some difference between both. The metagenomic based in enrichment sequence that you can really increase the panel of viruses or bacteria or other pathogens, but it's limited in the sense that you need to define the large target before.
I'm sorry, Ricardo. Sorry to interrupt you, but I think your presentation isn't moving.
No? Can everybody see now?
Yes, we can see it now. Yeah.
Is it passing the slides? Okay, thank you. And sorry all. So we have the first strategy based entirely on amplicon sequences, and this first one depends on know the pathogen in the sample beforehand. And then you have metagenomics based in enrichment sequence, and I know these could be discussable, but even though it's being defined the pathogens that need to be targeted, there are some conservative regions that might be a way to identify even unpredictable pathogens in this strategy. And then we have the large open strategy, metagenomic through shotgun sequencing. And basically is the attempt to sequence everything. Of course, there are a lot of challenges in both strategies, and these we can discuss later. So to use metagenomics for public health, first it's important to understand or trying to define a little bit the pattern of outbreak emergence. And then we have the first part of the slide where we have the One Health approach, where we have the wild animals that are infected with pathogens that might, for some reason, spill over to the humans. And then in this part of the outbreak, we have a few cases running, but they are not enough to make the human population to run to the hospitals. So here we have several cases, but in a low number of cases. And then we start to see the number of cases increasing as severe cases in the hospital, as in ICU, and also death cases related. So here we can frame as low circulation and then spillover phase, and then we have the emergence with human transmission phase, and then you have the amplification and the community transmission. So using metagenomics, we can define different strategies to try to identify the pathogens in these three different phases. So for example, wastewater or pooling of vectors or pooling of wild or domestic animals death. During the emergence, we can do active surveillance in the population at high risk, and then we can do at the later phase pooling strategy in the primary care hospital unit, or even ICU or death cases investigations. So at what point do we deploy metagenomic in public health surveillance? So early warn versus outbreak response. So if you take in consideration a couple of experiences that we had with pathogens in Brazil and in the world, we had, for example, the Zika virus that it was circulating in the country 2 years before really the outbreak. And we are only able to detect this pathogen when we had the big outbreak in 2015. Nuno Farias, that most of you knows, for example, using molecular clock defined the introduction time of the Zika virus in 2013. We have also the Oropush outbreak in Brazil. And Felipe Naveca, for example, was detecting the circulation of the Oropush long time ago. And by his way of investigating, he could detect a small outbreak just before the big outbreak of Oropush. And then it was able to make the health system act before the big outbreak in the country. And then if you see the H5N1, the avian flu virus, we are in these phases just before or in between the spillover event. And during the alert signals, we can do the response during the syndromic alert when it goes really high, or the death alert. And then in our case, we have different projects that are running on. So we have one in wastewater. We have the genomic surveillance of Fiocruz. We have one that goes for a vulnerable population in the country. And then we are working also with infectious diseases hospitals, and also the investigations of death. So here is the first clinical metagenomic case that I want to present. It was a case that the patient entered in the ICU with SARS-CoV-2, and 6 months later, there were no detection by PCR of SARS-CoV-2. So the clinician asked me to do some metagenomics to try to understand if it wasn't a bacterial infection. And actually, at the bronchoalveolar sample, we had a very low replication of the SARS-CoV-2. We could sequence them using the enrichment protocol with a full genome detection, and then the clinician could administrate the remdesivir, and the patient fully recovered after 6 months. Metagenomics is in this sense, as in the individual process, it could also help to exclude infections. And in this case, it was a granulomatous encephalitis that it was excluded by metagenomics, and then the patient could be treated with anti-inflammatory corticoids. Considering the metagenomic confirmation of cause of death, we could combine we identify an infection combined of pneumonia and a cytomegalovirus pneumonitis. So here we have the histopathological slides. I know it's small, but here we can see a pulmonary necrotized pneumonia suggestive of Pseudomonas infections, and then the cytomegalovirus. Through the histopathology, it was quite easy to see the cytomegalovirus infections also through immunohistochemistry, but the Pseudomonas was only revealed by the enrichment panel strategy that we used. So it was then the first use for this death detection in our country. So metagenomic surveillance also detects out-of-season respiratory virus infection during the SARS-CoV-2 pandemic in Salvador. So in this case, it was a surveillance of the health population in a vulnerable area of the country. So it was more than 1,000 houses, and we investigated 3,000 residents, and we identified 500 reported experiences of infection. So here is the area. It's a slum area in Brazil. And using the strategy of combined PCR for SARS-CoV-2 with sequence using tiling. And then we used a multiplex panel for SARS-CoV-2, flu A, and RSV, and you could detect this outbreak of flu A out of season. And then for the negative samples, we used either shotgun or enrichment panels. And it could detect a gamma of different respiratory virus circulating in this population. And then here we can frame, for example, the landscape of pathogens in our area. So we also could compare the RT-PCR with the shotgun results and the RT with the enrichment. The enrichment just amplified the RT-PCR, while the shotgun was not really effective to detect the influenza. So at excursion, we uncovered a wide range of respiratory virus and co-infections. We detected this off-season influenza A. We observed the secondary attack rate of influenza A lower than SARS-CoV-2. And these emphasize how COVID-19 altered the landscape of respiratory virus transmission. So, and then we come to an integrate NGS driving pathogen characterization into a syndromic-based early warning system for timely response to respiratory outbreaks. So the idea here that we have different models. One of them is to give alert based on primary healthcare results. And then from these, we can go for metagenomic in these areas. We worked with 7 different capitals in the country, so covering all the regions. And we collected more than 1,000 of samples, and we work with them doing pool of 10 samples for each time. So you could see a very large landscape of pathogens with circulation of, for example, SARS-CoV-2, adenovirus, influenza A, B, and C, different seasonal coronavirus, RSV also, and others here, RSV and rhinovirus. And then when we compare this strategy of pooling with RT-PCR with individual results for different viruses, we had a really high sensitivity and specificity. What could be a really good strategy to lower the cost and increase the detection of pathogens. One thing that we need to be aware is the contamination, that it's really hard to deal during metagenomics compared to RT-PCR. And even with contamination in some sites that were investigated, we could even, if we have a very well-established data set as it is for SARS-CoV-2, we can differentiate the reads that are present in the sample to the contamination that is in the lab. And then we make a comparison of the reads using the FREA pipeline, compare our results with the GSAID circulating at that time. And we have a very high concordance. We can do this using the EPI-WIN pipeline also for influenza genomes variants. And then you can very specify which flu is circulating at the region, and also for RSV. So metagenomics also depends a lot on the database that you're going to use to do the analysis. Using those results and compare with the outbreak alerts based on the primary care, we could see, for example, here in Porto Alegre, that during the alerts, we had circulating mainly influenza, SARS-CoV-2, and RSV, while in other areas that we had really low alert, the circulation of pathogens that has low severity in the population. For example, in Manaus, here, we had the circulation of adenovirus. So the pooling strategy was cost efficient and compatible with national surveillance workflows. Amplified contamination challenges were addressed through laboratory protocols and stringent bioinformatics pipelines. Seasonal trends in pathogen circulation aligned with ISOP alerts, high virulence virus epidemic events versus endemic low virulence virus activity. And in resource-constrained sets, early syndromic warning system can guide cost-effective genomic surveillance through targeted sampling and pooling strategies. So then for public health, metagenomics in the pre and early alert system can give a discovery of unexpected pathogens, pathogen landscape definition, and pre-spillover risk assessment in the intermediate alert system, discovery of unexpected pathogen, co-infection detection, and pathogen landscape. And for the late alert system, it could be a better treatment, reduce hospital length of stay, description of severe outcomes, and co-infection detection, pathogen landscape, and still discovery of an expected pathogen. So here is the coordinators of all these projects that I collaborate closely. So the Genomic Network with Professora Marilda Siqueira, the ESOP with Manuel Barral, the Field Alert for wastewater with Lourdes Aguiar, so the hospitals and the infectologists associated, Nancy, Aurea, Betania, Veronica, for the death investigation, Geraldo Gileno and Washington Luiz, and the Paulo da Lima community with Professor Albert Cole. So here are all the fundings that were responsible to all these projects in Brazil. Thank you.
Thank you very much, Ricardo, for that very comprehensive presentation, taking us from individual cases to respiratory virus infections in an area to, well, early warning alerts. So giving the whole overview. Thank you for that. And I request all attendees to put your questions. I see you have quite a few in the Q&A. And I'd now like to give the floor to Eric Carlson for more respiratory viruses, I think, and metagenomics. Over to you, Eric.
Thank you so much. Please let me know when you can see my slides. Are we good?
Yes, we can see the cover slide. So
Okay, perfect. So thank you so much. My name is Eric Carlson. As said, I'm the head of virology here at Institut Pasteur in Cambodia. And I'm going to talk a little bit about how we can use metagenomics a little bit differently, coupling it with environmental surveillance and sort of ecological sleuthing to uncover, both zoonotic and seasonal pathogens at the human-animal interface. So in case you don't know where Cambodia is, it's a small country in the southern Indochina Peninsula. It's a least developed country with a population of about 18 million. It is a hotspot for emerging and endemic infectious diseases. And there's a really large dependence on agriculture. There's a lot of people that have backyard farms and other things, and about 90% of those actually raise poultry. There's also a number of different interfaces. There's a really high level of biodiversity, changes in nutrition, social interaction, culture, and economics, which make it really a fascinating place to study these interfaces for high risk for potential spillover as well as pathogen prevalence. So in Institut Pasteur Cambodia, in the virology unit here, we've been studying the animal-human interface for over 29 years. And we study a number of different things. Here I've just listed a few of them. And you can tell that if we were going to do PCR or anything like that for these, it would take a long time, right? So we've obviously been looking for ways to better understand how we can sample as well as test things at interfaces very quickly and get a really comprehensive view of what's going on. And really what that is to do is to, improve early warning. As you've heard my other colleagues say on this call, we want to be able to anticipate the risks. We want to be able to prevent those risks. But, we need to be able to detect the risks before we can do those things. And then, of course, we need to be able to use that data to respond. So hopefully I'll touch on all of these today. Anyone that's done surveillance at these kinds of interfaces know that high-risk interfaces really require active surveillance. And active surveillance is really costly and time-consuming. And it's often not always done in the easiest of places. Sometimes we have to be out in these very remote places looking at what's going on at particular interfaces. So environmental samples really present a viable option for us because, they can increase speed, they can increase comprehensiveness, biosafety of the people that are actually taking the samples. They actually increase animal welfare, and they greatly reduce cost. So, I think that these are all really, sustainable options for us. And we can take, a lot of different kinds of samples. A lot of people just talk about wastewater, but you have to think about environmental sampling as a number of different things you could look at to actually understand what's going on in an interface. So here I've just put up some examples that you could actually take in, say, a live bird market. And we've been studying these live bird markets and things like that for a long time, where we've been looking at things like feathers, waste and wash water, cages, surfaces. But now even more, we've been looking at things like air. How do pathogens actually transmit through the air or increase zoonotic risk? And we're doing air sampling in things like live bird markets, lots of different types of live bird markets, lots of different types of samplers. But we've also been doing it in places like bat farms. So this is a bat farm for anyone that doesn't know what a bat farm is. Each of these palm fronds is actually full of these little tiny Scotophilus bats. They live in small colonies. So we do things like soil, urine, and feces, but also air sampling. So, we've been able to collect air in these farms, in things like fruit bat roosts, looking for Nipah and leptospirosis. And then, of course, in bat caves here in Cambodia, with things like rhinophyllid bats and things like that. And we can do this in a number of different manners. We can bring these samplers into the caves. We can actually put the samplers under the bats as they're flying out. And we can do it in lots of different kinds of caves, such as like these really deep caves where people can go down and actually place these samplers down in sampling locations. We do it in things like swine farms. So if you think about things like JEV, again, Nipah, avian influenza, et cetera, there's lots of swine surveillance going on also for agricultural purposes, but also in things like air. And we can even do it handheld now. So there are handheld air samplers that allow us to get close and personal to our subjects or to points of high risk, say like this defeathering machine. And we use these extensively in our surveillance efforts, not only in markets, but also with certain animal types or even for wild animal surveillance. And in case anyone ever wanted to know how to swab a civet, this is how you swab a civet. But these handheld samplers even allow us to do things like use them remotely. We can strap them to the top of drones. We can put them on remote controlled cars, and we can get to places where potentially we don't need to be or want to be, or it's unsafe to be. And we can use them very actively in places like caves and get deeper into places, or on farms and things like that, where we may not be able to go, or we can use these drones to actually go for us and prevent us from spreading disease from farm to farm. So the question with this webinar really, and I know I spent my first couple minutes talking about sampling, but can we combine these novel sampling techniques with metagenomics for even more rapid information? And metagenomics really increases the utility of our environmental sampling in many ways, and we've talked about a lot of these things throughout the course of this this webinar so far. But I just wanted to reiterate, the unbiased, broad, dynamic way that we can use these samples within, metagenomic discovery as well as functional discovery is really, really important, and it adds to that speed and comprehensiveness and cost. So, I just wanted to answer a few questions during this webinar was, and we get these questions a lot, like things like, can we use NGS and metagenomics to actually detect viruses in environmental samples from, say, a live bird market? The answer to that is yes. So if you see very quickly here I'm showing, again, this is probe-based metagenomics. We're looking at viruses on the left side with samples on the right. So you can quickly see that the air is giving us a real big diversity of samples that we detect in these live bird markets. And I can tell you quite clearly that if you detect, say, 70 viruses in a bird sample or a pool of bird samples, you detect those same 70 viruses also in your air sample, but also 300 more, which may be associated with many, many different things. And that holds true not only for these markets, but also for things like swine abattoirs. Here, the pattern's not as pretty, but again, you see really high diversity in things like air, where we're detecting lots of different viruses compared to just snout swabs. And then in bats. So here I've put air samples from bat caves and roosts compared to just feces and urine and organs. And you can quickly see that we are detecting a lot of different viruses in those samples compared to what we detect in just, say, a direct sampling situation. So the answer to that is really yes. We can use these samples with metagenomics to actually make decisions. The other thing is NGS actually comparable to qRT-PCR? And this gets asked a lot. So if we look at, say, the number of influenza reads or the reads per million that we get out of these samples, we do get a significant correlation between reads and reads per million and our PCR values. And even we're detecting things, say, above a level of PCR detectability, which can be talked about a bit later. This holds true down to that 100 base pair level of detection. So a lot of people say, well, you're only detecting 100 base pairs out of your M gene. Does that actually mean it's comparable to your amplicon reads or your reads per million? Yes, it does. They're statistically correlated between the two things. So you can actually use your metagenomic data to look at the level of contamination or validate that you're actually detecting the things that you think you're going to detect. And you can use it, not only for detecting a virus, but also subtyping a virus. So here's data on H5 from these samples from the live bird markets. And again, you do see a correlation between these as well. But we can also use it to have more robust data because we're also getting full genomes from that. So, our ES sample is actually able to effectively replicate what's being detected in the poultry market. And if we just look at, say, our genomes that we're detecting, and sorry, the slide is slightly busy, but you can see quite clearly here that what we're detecting in the environment is exactly the same as what we detect, say, in bird samples. So if you look at this combination down at the bottom left, that's a duck sample and an air sample taken on the exact same day at the exact same time, and we're detecting the exact same virus in both samples. What's the advantage of these environmental samples is that we are actually detecting clades and things that we are not detecting in bird samples. So if I am going and collecting 40 birds from a market, but 10,000 birds go through that market, obviously I'm going to miss things. However, with just 3 air samples, we are able to detect 2 different clades of H5 that have gone through that market in a day when we didn't detect those in the birds at all. So the answer to this, to us, is really yes. There are caveats to both of those questions. You know, we may need to take multiple environmental sample types. We do have to do metagenomic sequencing, and we're still working on making that faster and more accessible. But this really is a nice option for us to understand what's going on in the risk. But, you know, and I think we touched on this, and I've seen some questions in the chat and things like that. But, you know, metagenomic sequencing really generates a huge cornucopia of data. We're dealing with this heavy burden of data that we really want to make reportable and actionable. And I think that's what we really need to think about as a community, is how do we use this data to actually, you know, do something about those pathogens in these high-risk interfaces. And so we've been really thinking about this at IPC. We've held workshops on this in Cambodia. We're expanding those to other countries, where we've even gone down to a point of looking at what colors matter to people, what kinds of graphs matter to people, how do they determine what an actionable threshold is. And I think really what we've found is that, you know, right now, because of the state of metagenomics, you know, a lot of countries want to focus on priority diseases. That's great. You have to make priorities for what diseases you're looking at, but you have to remember you also have all that data. We're still working on validating all this. And I think you've seen from my colleagues that, you know, validating each of these pathogens that we're looking at is you know, really important for accuracy, precision, and sensitivity, not only in the clinic, but also when we're doing surveillance. Of course, we have to partner with all our stakeholders and, you know, really understand how we're visualizing this data. It's really hard to look at these big heat maps and things like that and know what to do. And really working on automated bioinformatics tools. There's a lot of good bioinformatics tools out there. How do they work? How do they compare for different surveillance efforts? And then finally, how do we use this data differently? And I really want to push on that. We need to change our paradigm that it's not just one sample, one diagnosis, one reaction. We need to be able to take environmental samples and use metagenomics, understand the hotspots of disease, the epidemiological context, and then really go to host functional data to inform our actions. And I really call for a paradigm shift in the way that we use metagenomics to make those decisions. So with that, I'll just say thank you to all of the partners that we work with and everyone who funds this research. You know, special thanks to people like Bill and Melinda Gates Foundation, Wellcome Trust, and a lot of other partners that we work with. All of my contact information is here if you'd like to get in touch with me. And with that, I will thank you very much for having me, and to WHO for hosting this webinar. Thank you much.
Thank you very much, Eric, for that very comprehensive and clear presentation, and wonderful slides, I have to say. And I now request Greg Armstrong and Caxton Marira to move on to the Q&A, because there are lots of questions. And as you can see from the emojis, lots of interest as well in this work. Over to you, Greg and Caxton. And thank you so much, Eric.
Yeah, speaking on behalf of the two of us, let me concur with that. Excellent presentations. There are actually a lot of questions on a lot of different themes. There are 3 themes I think that keep coming up again and again. One is about costs, another is about incidental findings and what to do with those. And I think the last presentation got into that some. And questions about ethics, but before we get to those, let me just ask the panelists, you know, a question. So, for a country that is already has genomic capacity, is already doing maybe whole genome sequencing or you know, amplicon sequencing, where does it make sense for them to get started in metagenomics? What do you see as the first applications for that? And I guess we're directing that at any of the panelists.
I can jump in on that potentially. I think I mean, it is very difficult. There was a number of questions in the chat about how to utilize it most effectively. I know that, for example, in the UK, the first sort of use case was really in NHS trusts, particularly in acute severe respiratory infections, where perhaps a diagnosis hadn't been made. I think sometimes that can be difficult because it raises all the issues that people have raised about how you decide what is important and what is not in an individual patient. I know one thing that has been very helpful in our intensive care units has been in allowing antimicrobial stewardship, so allowing clinicians to feel like they can safely stop antibiotics rather than necessarily start them. But I suppose probably that's where I would see, if you were starting out, that's probably where you would start, the sort of very severe acute infections. But yeah, happy to hear others' views.
If I can jump in just for a second, I suppose. Where do you start? You start with an assessment of what your needs are for your particular laboratory and for your system. So there's a lot of different sequencing platforms out there. There's a lot of different kits that you can use. There's a lot of different bioinformatics that you can use. So, many of us built up sequencing experience over the COVID-19 pandemic, and that's great. How can you utilize what you have in your lab? And you can do metagenomics on a nanopore Mark 1B if you really wanted to, right? It just limits your ability to potentially do very deep or very extensive sequencing. But you can do this in a cost-effective manner. So doing that assessment in your own lab or in your own system first, I think, is where the critical first step, and prioritizing, what kinds of samples you want to be sequencing, whether that clinical or environmental or animal, in that manner.
And Ricardo, I don't know if you had any comments on that.
No, I think it was really complete, but I think maybe if you start really cheap in the beginning, trying strategies to understand the troubleshooting that you're gonna need before going to large sequencing models, because there are a lot of learning in the process of the wet lab control and also in the bioinformatics. So depend on the methodology that you're going to use, you're going to be aware that the computational structure going to be much expensive and robust than if you go for other technologies. So all these going to be involved in the process. So step by step would be my advice before go to really metagenomics.
Yeah. So, and first off, Supriya, please let us know when we have to when we have to stop. But a question that my colleague Caxton has been tracking is around the ethics. Anna got into this early on, but when you're doing metagenomic sequencing, you're going to pick up a lot of human DNA. It's hard to avoid that. The question is, how do you deal with that, and how do you deal with the ethical issues around that?
Yeah, so I mean, that is one of the key considerations, I think. There's obviously, a number of different techniques, both sort of wet lab techniques that can be used and bioinformatics approaches to try and remove as much human genomic data as possible. But I think we, all agree that it is impossible to remove all of it. And I think it's really about having a sort of essentially having a framework and an agreement on what levels we are willing to accept. And I think at the moment, certainly for the public health surveillance use case, I'm not sure we have enough evidence to say that we would be sharing data widely because of the public health benefit. But that risk benefit, of course, might change with time. I think certainly at the moment, the use of metagenomics in the UK is all very much in sort of trusted research environments. There's not there's not sort of wide sharing of data, and I think it will probably remain that way for a while, I would expect.
Yeah. Other comments, Eric or Ricardo?
No, just from me, I think on an ethical level, Anna covered most of the issues, and these are still things being discussed. You know, not only how do we use the data, but how do we protect it, and how do we make sure that we're not we're removing as much issue as possible. And there's a lot of people doing ethical reviews on the use of metagenomics in all types of samples now, and I think that'll be a conversation for the future as well.
Hi, Greg. I think we are on time now. It's up to you and the speakers if you'd like to have two more questions, but we have reached 2 o'clock.
Sorry, all, I'm gonna have to hop off, but thank you very much for having me, and see you later.
Just maybe one last question just about costs. I don't know, Anna or Ricardo. Metagenomic sequencing can often be much more expensive than targeted sequencing when you're looking for a specific pathogen. But is there anything else you could say about the costs of metagenomic sequencing?
Well, I think so. There was a question in the chat as well about that. I think it's very difficult, and obviously it will be very specific to each setting and what they have available to them. But I think the onus is on those, countries and organizations that are using it to essentially share as much as possible of the data that they produce. So as part of ENDSCAPE, for example, we are doing some modeling work looking at how much quicker we might have been able to detect a pathogen if we'd had metagenomics as part of our public health surveillance. And I think those sort of models can potentially inform, other countries, organizations that are thinking of using it to decide whether it essentially would be cost effective or not. Similarly, sort of sampling frameworks, I think, are very important so that you get the most bang for your buck.
Yeah, so from a societal perspective, there's probably some real cost savings associated with it. I think is what you're saying.
Yes, I think so, but I think there's a lot of work to be done to know how it can be deployed most effectively. I think is what I would say.
Yeah. And Ricardo?
Yeah, there are a lot of studies also showing that you can decrease the value of the metagenomics, like reducing the number of reads necessary to identify it, and also the number of the size of the reads that we're gonna do. For example, we showed in our study, for example, that we can do also full analysis to have this landscape, and all these comes really close to a cheaper way to do metagenomics. So one thing that maybe it's important for the general attendance, that normally metagenomics started to do the discovery of the really unknown pathogens for microbiome or for virome. But when you study clinical samples, the most predominant going to be the pathogen that are causing the disease. So this means that you need to sequence much less than the other studies that were doing, for example, environmental microbiome. So if you put in this context, then the cost of metagenomics is not that high anymore.
Great. Well, I realize we're running a little late, and we've kept our speakers as well as 760 people over time. Supriya, should we wrap things up?
Yes, I think what we'll try and do is have a look at the questions, and if possible, see if we can answer some for and put it on the website. I'll discuss that with the technical team that's organized this, if that's possible. But thank you to all the attendees for your questions. And thank you, Craig and Caxton, for moderating this session. I'd like to hand over then to Josephina for the closing. Over to you, Joseph.
Thanks, Supriya. Thank you all to all the speakers who gave a great overview on how metagenomics can play a role in infection disease surveillance, highlighting its potential in detecting emerging pathogens in clinical settings, and as a tool also to investigate outbreaks of unknown origin, and its role in helping us to detect novel transmission at the human-animal interface. Thank you also to EPI-WIN, the Science for Africa Foundation and Task Force for Global Health, who are supporting IPSN with the organizations of this webinar through their role as co-host of the Pathogen Genomics Founder Forum. We look forward to continue this collaboration and providing these regular webinars on the utility of pathogen genomics across different disease applications and settings, and would welcome any suggestion from participants on future topics. Thank you again for joining this webinar.
Thank you.
Thank you very much,
Thank you.
Josephine. And huge thanks also to the speakers, to Ricardo, to Anna, and to Eric, who's had to leave to go on another call. This was really a very illuminating discussion. And you can see a lot of people have also put their insights and opinions in the chat, which we will share with you. So you can integrate it into when you decide your work as well. A huge thanks also to Timothy Dalman for reaching out to us for this series and for making this happen. And to the interpreters, our Spanish and French interpreters here, thank you very much. I'd also like to thank everyone working in the background, Michael and our WHO Collaborating Center, University of New Mexico and Project ECHO, especially Aparajita, who's also helped in the background, and our IT support here. So for EPI-WIN, we'd like to see you again next week. So next Wednesday, 1st October, we will be having an EPI-WIN on seasonal influenza vaccination. So we're kind of still on the respiratory viruses track, slightly different. And I look forward to seeing all of you. And once again, thank you to the speakers, to the technical organizers and everyone else. And most of all, to the attendees for being a part of the EPI-WIN family. Thank you. Bye-bye.